So, I'm talking today about the political and economic situation in Eastern Europe. So, uh, okay. So when we're talking about Eastern Europe, there are kind of two main groups. There's just general Eastern Europe, and then there are the former Soviet Union countries. The Soviet Union existed from 1922 to 1991, and over the past 20 or so years since the collapse of the Soviet Union, all of those countries have gradually gained their independence and have developed their own economic systems and political systems. So the Soviet Union countries in Eastern Europe were Belarus, Estonia, Latvia, Lithuania, Moldova, Russia, and Ukraine. And under the Soviet Union, the government, of course, was super centralized. Individuals had almost no power compared to the central government. In addition to that, the entire economic system was extremely centralized. So since 1991, so over the past 20 years or so, each country has gradually gained their independence and has created their own economic system. So at first, after the collapse of the Soviet Union and the independence of, at first, Lithuania, Latvia, and Estonia, and then the other Eastern European countries, the growth was very, very slow initially, and then there was a lot of political upheaval, which led to economic upheaval. So over the past 2 or 3 years, the economic conditions in Eastern Europe have changed to the point where there are extremely favorable conditions for growth. So in the last few years, the global GDP overall has stagnated. However, in Eastern Europe, it's been growing considerably. This is due to several different things, but most of all, it's due to low oil prices, improved labor market conditions, and a vast increase in Western European investment in Eastern European countries, which has led to an increase in automobile manufacturing as well as a significant increase in domestic spending. An example of this is in Slovakia. In just 1/4 of this year, their entire GDP grew 4.2%. And that's indicative across the region. And the Czech Republic their GDP is expected to grow 4.5% this year. And so, although unemployment rates are still very high, up to 50% in some countries, they are decreasing considerably as their economy grows.
So I'm going to talk a little bit about the burden of disease in Eastern Europe. So Eastern Europe has obviously made progress in reducing mortality and prolonging life since 1970. However, it's important to keep in mind that after the collapse of the Soviet Union in the mid-1990s, there was increases in adult mortality in the region among men ages 45 to 59 years. So now we'll talk a little bit about current trends in Eastern Europe and how they compare to what's going on in global patterns. So health loss from tuberculosis decreased by 18% at the global level, but it increased by a startling 36% in Eastern Europe. Certain non-communicable diseases were much more prominent causes of premature death and disability in the region compared to the world as a whole. For example, depression ranked 4th in this region, but ranked 11th when looking at the global community. Road injuries ranked 6th as a cause of premature death and disability in the region, and ranked 10th at the global level. Another cause that ranked higher in this region compared to the world was cirrhosis. Between 1990 and 2010, disease burden from many non-communicable causes increased. Today, drug and alcohol use disorders are causing more early death and disability in Eastern Europe compared to 2 decades ago. The region has seen a sharp increase in injuries associated with interpersonal violence and self-harm, but there was a decline in injuries resulting from fire, drowning, and poisonings. The leading causes of disability in the region largely mirrored global trends. Mental disorders such as depression and anxiety, as well as musculoskeletal disorders, were dominant causes of disability. Dietary risk, high blood pressure, alcohol use, smoking, high body mass index, and physical inactivity were leading risk factors for premature death and disability. Over the past 2 decades, the region has succeeded in decreasing premature death and disability for most communicable, newborn, nutritional, and maternal causes, with the exception of HIV/AIDS. But despite these improvements, it's important to keep in mind that substantial burdens of communicable, newborn, nutritional, and maternal causes persist in some of the more poor countries in Eastern Europe.
So I'm talking about barriers to healthcare in Eastern Europe. Once the Soviet Union ended, Eastern Europe turned to healthcare practices. They changed kind of the centralized healthcare to be more private sector involvement in healthcare and financing and coverage. And so basically, people who are employed, part of their income would be taken for their healthcare. So this caused huge barriers for people who are unemployed, maybe are working in informal sectors, people who are not like citizens, such as refugees and ethnic minorities, and these people were unable to get healthcare unless they pay out of pocket, and most of them can't do that due to impoverished situations. And so that really puts a huge barrier on these people getting healthcare. Also, since the Eastern European area is huge for informal employment, they have a hard time raising enough funds through income taxes and through these programs that take money from payroll to create enough money to really support the healthcare system. And so this map shows in 2012 the percentage of GDP spent towards healthcare in Europe. So as you can see, like the Eastern Europe countries spend a lot less than the rest of Europe and the European Union. And this is a barrier to good healthcare. So, doctors, so kind of as because of the centralized healthcare system, doctors still aren't really getting paid what they would get paid in other areas for their work that they do. And they will take kind of bribes or alternate payment forms in order to give higher health care, which kind of creates this two-tiered healthcare system where if you can't pay the bribes, then you don't get the best healthcare that is available. Moving towards like another area that causes significant barriers would be conflict within countries, especially Russia and Ukraine. The conflict that's going on there has led to the downfall of the Ukrainian healthcare system. It isolates individuals who are in those conflict areas. It makes it difficult for them to get the care they need. It also causes problems in hospital infrastructure. They're constantly dealing with power outages and water outages. The staff will flee conflict areas, and so they're going to be understaffed hospitals. And it also creates like a heavier strain due to like death and disease and injury in these areas. So the combination of the two really leads to insufficient healthcare. Another area that's really had burdens placed upon their healthcare system is Turkey and Greece with their influx of refugees, especially since most of these areas are supported by people who are paying into these healthcare systems. When these people come in that aren't actually citizens, they have to know how to deal with them, and they haven't really figured that out yet, so there's a huge burden on them that way. Also, Turkey has had a recent military coup, so there is political instability in the country, which leads to the degradation of social programs, especially healthcare. And basically, just there's a huge amount of social inequality throughout all of Eastern Europe. Like there are varying degrees of economic growth, varying degrees of well-being, and so these obviously they correlate directly with the healthcare in the country. The better off a country is, the better their healthcare will be. So varying degrees within Eastern Europe.